It is now time to pass the presidential reins to our next leader, Dr. Jeff Maire. It is my honor and privilege to install you as the 165th President of the Iowa Medical Society. You have my absolute confidence in your ability to lead the Iowa Medical Society during this next year, and I know you will do so with great vision and distinction. I'm proud to present you with the Presidential Medallion to signify your position as the leader of our noble profession.
Vicki leaves and says she's done. I don't necessarily think that's true. Thank you, guys. I'm Jeff Maire. I'm a general surgeon here in Des Moines, and I am very honored to be here to become your president. I have a few things I want to say about things, but I want to start with telling you kind of who I am and who's your next president. I do want to mention for Vicki that we've kind of shared this last year a little bit here and there, and I kind of continue to do that next year is my expectation. So we've always made the trip when the other one hasn't, and I think that's going to continue on for another year probably. But I'm very honored to be here, and I want to thank all of you. This is a very powerful crowd. I'm pleasure to see everybody here. Mr. Houston is here, and I had not met him before, and long-standing, but even the young punks in the society know who he is. So yeah, we appreciate that much. Talking about me and where I come from, I'm going to introduce my family. They're the ones that really keep me going, and I think they know that very much. My wife, Margie, stand up, please. Next to her is my son, Ryan. I'm privileged that he actually skipped the baseball game to come here. So, yeah, it's a good thing. My daughter, Rebecca. The sunburns from the earlier baseball game. And my mother, Marlene. I also should put a couple shouts out because there's part of reason that I'm here is a few people that are around the table as well. I want to thank Leanne, who's my office manager, because she keeps me going just as much in some ways as the rest of my schedulers and everybody else in the office. So it makes us be able to do this job. So thank you, Leanne. And her husband, Randy. Yeah. I'd also like to go on to that other side and make sure that Dr. Angela Franklin is here, and she is part of it, as well as her husband Thaddeus, for Des Moines University. And I've served before in the Department of Surgery there, and pleasure to work there, and have very high regard for them and what they do for the university. And I can't not say anything about Tom. Tom Evans is kind of one of those guys that drug me around a little bit and said, you need to say this here and there, so I have to beat him up a little bit too when I'm up here and I have the podium. He's a great leader and former president, and has given me a lot of direction. He's crazy enough to make me actually board chair for the Iowa Healthcare Collaborative as well, so we have to work together a lot, and I appreciate his help at all times, and I'll utilize him as much. The last one I really want to put a shout out to is Rob Lee, because today, it was his last board meeting yesterday. He's this important guy in the family practice setting, and he's in the national level, and it's tremendous to have him around. He was president when I was board chair. He really is what makes you kind of become a leader, and I appreciate that a lot. So thank you for being here. And then I'm going to miss a bunch of other people. And John's, of course, a surgeon, so we kind of get along that way too. But let me tell you a little bit about me and where I came from. I'm going to try and make it shorter so that we can get on to freestyle and dancing. But I'm a native Iowan. I grew up in Cedar Rapids. I've traveled around a little bit. I've lived in Atlantic. I've lived in Storm Lake as a young child. I grew up in Sioux Falls, South Dakota for a little while, and then ended up moving back in 8th grade to Cedar Rapids again because they wanted to get close to home. So I've loved Iowa for everything that I've known, and it's a great state to be in. I think the physicians are great, and I actually hadn't thought a lot about medicine during that time because I didn't have medicine in my family. So that wasn't the highlight of where I was at. I was going to be an engineer, and so I became one. When I graduated from Cedar Rapids in high school, I ended up going to Iowa State. I had to take one semester jaunt down to Arizona for a bit, but the grades brought me back to Iowa State so that I could actually go to school. But I graduated there in 1992, and I ended up spending a year at University of Iowa as a nursing assistant. I had a great year. It was one of those times where you learn a lot about who you are, and I wouldn't trade it for the world. I worked on 4 Southeast, and some of those that are there know that was med psych back then. And I had a lot of fun during that time, met some great people, observed a lot of people like surgeons that would actually come over there on occasion, and it was a good time for me and a great time in my life. But then after that, I ended up matriculating to Des Moines University, and I graduated from there in 1997. I went on to do an internship in Texas and did a traditional rotating internship that is all but gone now because people don't think of that anymore. They go into regular residencies at this point. Then I did 4 years up in Michigan and spent time in Flint, Michigan at a place called Genesys Regional Medical Center. It was a great place. I had great training. I went all over. I kind of am a believer even in medical school. I did OB-GYN rotation over in Pittsburgh. I went in Pennsylvania and did a family medicine rotation. I've been kind of in a lot of places because I wanted to see what medicine was like, experience it from different places in the country. So in residency, I did pediatric surgery up in Saginaw, but I also went and did trauma down in Las Vegas. That was fun. 6-state area, 100 people on the service. It was just, it was very busy. It was a fun time. And then I've been out in New York. I actually went to Sloan Kettering for 2 months because I wanted to experience where the high volume pancreatic surgery and the people who are really stalwarts. So I had a great time out there as well. After that, I ended up practicing in Missouri, so Dr. Coughlin. So I spent 2.5 years down there, and I was in St. Joseph, Missouri, and spent in private practice. So I was there with 3 other surgeons, had a variety of backgrounds, and had a great training period. Those of you that are medical students will learn that first year of your life when you're out in the real world, you learn a lot. It's a great time. So from there, we ended up getting the opportunity to come back to Des Moines, and the group that I was admired since I was in medical school had an opening for me, and so we ended up making the move back there. So from there, we entered into general surgery practice and have had a great time here since. My medical career actually got started because I think that's one of the things that I was told that I should probably tell you about, because I said earlier that I hadn't really thought that going into medicine was the thing for me. And I think you see that a lot in what you see out there now, in that people start in one career and end up in a different career, or may make 3 or 4 changes in their time. I learned that actually at aerospace engineering when I was at Rockwell International, and an electrical engineer came up to me and he said, "Yeah, I don't plan on doing this all my life." And he was a really young engineer, and I just kind of was flabbergasted by that. But in medical school, getting into that was kind of a goal of mine as I entered into about 91, and everybody can kind of understand that Desert Storm and some of those bombs and everything going on. It was a time of turmoil, and there weren't a lot of jobs in the aerospace industry. So I ended up saying I got to do something else. And I'd love to tell you a glamorous story saying, hey, I wanted to do that, but I was actually watching television and I said, you know, I could be a doctor. It's as simple as that. And my wife always loves to say this because she's a University of Iowa graduate from the nursing program. And so we have that back and forth, and it's a good camaraderie between Iowa State. She did go to Iowa State for a year, though. I just want you to know that. But she was in nursing school well before I even decided to become a doctor. So we had a time that we had to live apart for a year. It was one of those challenging times. We got married very young, and we just knew it was right for us. So it's one of those never having an issue with that, and it's coming up on 24 years this June. So I do remember the date, too. Yeah. That's enough about me. I'm not a big fan of talking about me. I want to talk about Iowa Medical Society and the representation that we have for Iowa Medical Society. I think it's wonderful the development that we have in Iowa Medical Society, and that's why I'm so appreciative of the past presidents that are here, of Rob and Vicki, of leading me through this. I don't think any of you know that, but the first year that we were doing Secretary-Treasurer, I was beat out by another person in that election, and that person ended up having other things that they had to do, so they ended up not being able to continue on. So I'm a short timer on here. I had to learn quickly, and these guys know it's difficult for me to do that. So, but they brought me along well, and I've been to a lot of the meetings, the National Advocacy Conference, the North Central Conference, where we meet and have great discussions about where the future of medicine is going. I don't think I need to tell anybody about the changes we're experiencing. It is going to take constant leadership to do this, and that's going to be my big focus for the year. I actually want to bracket my comments with leadership at the beginning and leadership at the end, because it's just that important. So we'll talk a little bit about that. I do want to say a little bit about crucial conversations, because I think that's part of what leadership is about. How do we have those conversations? That can be about your position with your patient, and choosing wisely is something we've talked about a couple times on the stage. And that really is an engagement of a physician with their patient to try and make the right decisions, because patient comes in with expectations. And that expectation, you have to have a good story of why that's not right to do that, and they have to be accepting of it by the time that they leave the room. And we all know that patient satisfaction is a part of what's going to happen as we go along in our judgment as we go forward. So I think that looking at those things is giving us power as leaders, and I think we need to use that to help our patients understand why healthcare is changing and what they need to do to better their lives. We talked about skin in the game and those kind of things, but that's going to come from us having the conversation with our patients as well. In terms of leadership, we're also going to talk about communication and engagement. Those are going to be my three main points, because if you go over three, people don't remember them as well, so nor do I. But it brings me back to a presidential nominee before, and he couldn't remember the third one, and I don't want to act like that, so I had to write them down. I got them written down, and I can see them, so we're good. But communication and engagement are going to be the things that we need to strive for, but it's going to take leadership to get there. And I think that's what makes me most excited about this, is to stimulate people to do that. Every person has the potential for being a leader, and for stimulating everybody else around them. And it starts with us. We talk about how physicians need to lead the organization or lead the team. That is so important. Now the team, we have to be leaders of it, but we're not controlling of it. We have a different stance than we used to have. And we need to learn to incorporate that in how we're practicing medicine, because that is our future. I look around, and being a general surgeon, I cut for cure. I look for doing an operation. I want to fix it and make it better. I admire you mental folks out there that like to sit there and keep working on a problem over and over again, and helping me out when I have problems in the hospital. But that's what we're going to have to work on, is that leadership of the team. How do we work together as a team? And every person can drive their other team members to be leaders in their own right. And that's what I'm looking to draw out of all of you. The person who really brought me into this was Dave Suskowski, and he's not here tonight, but he's currently the Chief Executive Officer of our Accountable Care Organization. He's been previously Mercy Clinic's CEO. He's been a leader that has kind of drugged me along the side when I was in the hallways with him many years ago, and said, Jeff, you got to go on this. IMS is going to help you out. It's a great organization. It's going to help you learn, make you a better leader. And boy, was he right. So he showed me the door. He let me open it, and fortunately I was able to walk through it, and because of the people around here, I'm actually up here on the stage, and that's what makes me get to where I'm at. I do want to talk about communication, because communication is so important, and there's so many facets to communication that we could talk an entire hour on it. And I wanted to say that it was going to be a short talk, so I've seen it linger, but the communication that we're going to have in the next year, I think you're going to be impressed with. The new software that we're purchasing and is going to be installed, I'm sure there will be, just like every other AEHR or electronic record in the hospital, there will be kinks to work out. But our communication as a medical society to the physicians, I think, is going to improve significantly. I expect you guys to look for it, and I expect you to beat us up if we're not doing that, because that's what we're expecting to see. We represent everybody. We represent the urban people and the rural people. We represent the solo and the large groups. I happen to be in a large group, but I started in a group of 4 general surgeons that were private practice. I had to do my own billing. I had to do all those things. We had to worry about all that. I went to a place where I didn't have to do that, not necessarily by choice, but that's kind of where I wanted to be and the people I wanted to be with. I'm an employed physician, but we represent all the independents. We couldn't live without them as well. They're just crucial to how society is going to be educated and evolve in medicine in the state of Iowa and the physicians that are here. I'm a specialist. We try and make that mix. We're always going to be looked at for, do we have the right mix? Do we have the specialist on the board? Do we have the primary care on the board? We are the house of medicine, and that's something that we're all going to represent. So everybody up here is going to say, you know what? I understand that general surgeons want to do this, but we got to do this for the house of medicine. And we're going to have some bumps in the road. I think you guys know the changes that are going on, and I'm looking actually forward to it. I've had people look at me saying, you're going to be president next year? Good luck. That can happen. But we need to exude the passion for medicine when we communicate to our patients as well. We're going to work on that commitment that's going to be able to bring them to know that we're passionate about medicine, and the patient is focused in the middle of what we're doing. That's what medical center homes are doing, and I think we need to work on expanding that to the specialist. We're learning about it. We've learned about it for 5 different discussions today, and they were excellent. And one of the interesting parts I thought was default strategy. This is something that was brought up by Dr. Terrell, and the default strategy of we're just going to sit here and let things go on and then see if it works. I call it bury your head in the sand. That just doesn't work. We have to be leaders. We have to be doers. We're learning it, but now we have to get out there and put the rubber to the road. I plan on doing that. I want to actually go out to many places in the state this next year and actually go face-to-face with those folks, meeting in society meetings, trying to stimulate the county society meetings. Whoever wants to meet with us, we want to try and do that. Because if we don't have the boots on the road, I don't think we get the engagement that we need. And that's what I plan on looking at doing. That engagement piece, that third piece that I want to talk about, is the professional home that we live in. And really, it reflects on all of us what we're doing. And I think that the leadership that you've seen and where we're going, none of us know what 3 years from now bring. The ACOs haven't reported their data in. We don't know what we're going to be doing. But by God, we need to be working hard to make sure that our patients are controlled and they're taken care of, and that we're in that leadership role helping them get to where the patient care pattern, the team is led by us as physicians, and the group is taken care of in the most effective manner. I want to kind of close with this Chris Lowney, who wrote the book Heroic Leadership. And I kind of like this statement. Leaders imagine an inspiring future and strive to shape it, rather than passively watching the future happen around them. So my job now is to challenge you to be leaders and work on it. And it really is involved in your health systems. I don't care if you call it a hospital system or a health system or a group or whatever, but we have to lead the clinical strategies that are going to take us forward. We've been working on it for years. We know the ACA is there and it's going to continue on. It'll be morphed. We have to be dynamic. You are making tomorrow potentially a decision that's going to make IMS a very nimble operating force for physicians in the state of Iowa. And I'm proud of you for doing it. Thank you very much.